access to healthcare.gov has been a miserably frustrating experience for way too many Americans.
Well, a lot of people would say that's an understatement. Problems still plaguing the ObamaCare website, but healthcare and the internet are working together in the private sector. These doctors posting their prices on personal websites for health services. Patients say it works great. So is this proof the private sector does a heck of a lot better job than the government does? Hi, everybody. I'm David Asman. Welcome to Forbes on Fox. Let's go in focus with Mr. John Tamny, Rich Karlgaard, Elizabeth McDonald, Rick Unger, Mike Ozanian, and Sabrina Schaeffer. So, John, government can't do the health care on the internet, but the private sector obviously can.
Of course it can. Capitalism and the profit motive are about turning scarcity into abundance. They're about turning $1 million computer in the 70s into something that costs a couple of $100s today. Healthcare is expensive and scarce today precisely because the government has naively removed the profit motive from the equation. President Obama wants to make it universal, and in trying to make it universal, he's going to make it very hard for the average person to get.
So, Rick, this just proves the fact that the private sector could do the internet, that when the government gets into something, it gums up the works.
Well, there's two questions there. Yeah, obviously the internet thing has not gone as planned so far. I think it'll be fixed by the end of November, but we'll see. But to the real question here, which is can the private markets handle the pricing? Look, it's really nice. If you need to go get an examination or a physical, whatever, yeah, you can probably pay cash at a lower rate through that internet advertising by the doctor. But that's not where the real costs are in the healthcare system. The real costs are in expensive treatments like chemotherapy for cancer, heart disease, heart surgery. I got to tell you something. You can cut the price in half, and Americans could not pay for that if they didn't have insurance.
EMAC, look at these doctors that we're talking about. We're not just talking about general checkups. These are surgeons that are doing this on the internet. Surgeons. Knee surgery. I had a knee surgery myself, cost tens of thousands of dollars. They're now advertising on the internet. So it's not just the simple stuff.
Yeah, it isn't just the simple stuff. I hear about the cancer treatment, but the thing is, if the exchanges are always so great, why not let them stand against the existing plans in the marketplace? Why do you have to go so far as criminalizing existing plans? Now we're seeing, tens of millions of people losing potentially their employer-provided plans, and the small business plans and the individual plans. The market was showing you how to do health care before Obamacare. It was providing cheap coverage for many people across the country. And I got to tell you something. There's no such thing as a free lunch. Right now, those surgeons, David, that you're talking about, they're doing that because essentially the hospitals are saying, you know what, we don't want to deal with health reform. We don't want to get paid by health reform.
Mike was saying, while these private doctors are doing great work on the internet, think of this, what the healthcare exchanges are doing. They have to register 39,000 people a day in order to reach their deadline, their March 1st deadline of 7 months. 39,000 a day. If they can't handle a couple of hundred a day at most, how are they going to handle 39,000 a day?
David, my beef with this whole Obamacare versus the private sector has nothing to do with the computer glitches. It has to do with the fact when you look at procedures that are handled by the private sector because they're not covered by insurance, like LASIK eye surgery, like dental implants, the quality of those procedures has improved dramatically over the last 2 decades, and the cost has fallen dramatically because they're not encumbered by all the anti-free market regulations that are in insurance.
But, Rich, one of the things that bothers me about all this, the mess in the government system with Obamacare, is that they may sour the public on anything on the internet, even the things that are working right in the private sector.
David, I think the public is smarter than that. There are two elements that you need for a real healthcare revolution. One is to bring in all the entrepreneurs to satisfy this growing demand for better and cheaper health care. And the second thing you need is price transparency. And as Oz points out, when you get that, you get LASIKs dropping, tenfold over 10 years. You can get your human gene, you can get your own gene sequenced for anywhere from $100 to $2,000 a day. We're on the cusp of an extraordinary revolution. Yeah. And if we only had price transparency and entrepreneurs coming in, I think that even expensive oncology treatments, to Rick Unger's point, would drop a lot.
Well, and Sabrina, it's just the opposite in the public sector. In the public sector, the more the government gets involved, the higher the prices become, right?
Right, and look, the government has been involved increasingly, both Republicans and Democrats, for over 4 decades in the healthcare system, which is why we haven't really been able to see some of these market proposals actually take place. But the fact is, if you move this to the private sector, we're going to see increased competition, increased choices, and a decrease in costs. And there's some tangible things that can be done, right? We can move to a system where we encourage health savings accounts, where we encourage the deregulation of the insurance market, where we encourage health status insurance. These are real things. Oh, we have to get rid of that tax subsidy for employer-provided insurance. There's some real, very, very substantive changes that could have been made that would have moved things to the private sector in a productive way.
And John, just to an overall economic point, the point is in the private sector there's accountability. If you screw up, somebody can go elsewhere. But if the government eventually takes control of the entire health care market, 1/6 of our economy, we'll have nowhere else to go.
Well, yeah, if the government fails, they'll just get more money to fail even more. And, getting back to Rick's point about, he's talking about catastrophic needs for health care.
Exactly.
That's exactly what the market can fix very easily in terms of cancer and heart disease. We could buy catastrophic insurance very easily and very inexpensively precisely because it's far more rare. You've got to let the markets in. What Rick is doing, and it's very naive, is going to remove that market force from it, and it's going to make it very more expensive and very more difficult for people to get it when they most need it.
Rick?
Let me tell you what's naive, John. I could respond to each one of your arguments if I had the time, but our friend David here told us about his knee surgery and how you could go about shopping for them online. You tell me, David, look me in the camera there and tell me you would have picked your knee surgeon based on price. You know you wouldn't have. You would not have shopped price. You would have shopped for the best.
That's absolutely no. That's absolutely. I'll look you right in the eye and tell you that's absolutely not true. We have several great hospitals here in New York that offer similar services, all of which are very, very high quality, and I choose based on the cheapest one with that high quality. That's the great thing. It's exactly what I did.
Yeah, that is what you do, unless you're not inclined to have Dr. Obama prescribe you a little pill, as he's been
because there are no choices. The problem is, when the government takes over the whole system and has a monopoly, eventually you won't have the choices either.
Yeah, that's right. And by the way, the government already is involved in half of the health care market through Medicare and Medicaid. The thing is, what you're talking about too, David, is choice. What we have now is government-mandated insurance plans. The insurers were sticking it to consumers. Now you have insurers sticking it to hospitals and doctors who don't want to deal with health reform, and they're going out into the market themselves.
Sabrina, go ahead.
Yeah, because the fact is that, David, you may have chosen a more expensive doctor. I have a doctor that doesn't take insurance at all, but I go to her because I think that she provides the best care for myself and the family, right? She responds quickly to emails, on-demand appointments. Sometimes that's valued by the consumer just as much as a lower price.
Rick, very often you have people willing to travel to India because their services are so much cheaper.
Actually, that's true, but I got to tell you, if you look at the real numbers on medical tourism, and I'm a supporter of it, you'll find there's not very many people who in fact travel to India.
By the way, Rick may still be supported, but even the liberal New Yorker has come out with a magazine cover that is chastising the president and Sebelius and all the rest of them for what has been happening with the Obamacare rollout. Books will be written about this, folks.
Can I do one of them?
When you're on your medical tourism tour to India, you can write a book.
Well, some folks have been warning Obamacare is just a step towards the government taking complete control of health care in America, but is the botched rollout changing that? Cashing in is on that. But up next right here on Forbes, first the food stamp cuts and now the fear. But the Forbes flip side says, fear not. Why cutting more, not spending more, will help you more. Well, how about working just 30 hours for the weekend? A group of economists saying a shorter work week would actually, quote, improve our well-being, our family life, friendships, and our communities, end quote. But EMAC, you say it's going to do just the opposite. How so?
Yeah, I'm worried that it would give the incentive to companies to do more in the way of cutting pay, and that would be bad. And you have shorter, work hours, but the same amount of labor costs going into the production of goods, meaning inflation, meaning higher cost of goods. And listen, it could lead to more government meddling, like a government-guaranteed minimum income like they have in Sweden. Even though I like the fish, I don't want to be more like Sweden.
Well, Morgan, now of all times, people say we need to work harder, not less.
You can work harder in a smaller amount of time, and that's the argument that Henry Ford made back when he scaled his factories down to a five-day work week in the 1920s. But I actually really like this idea. I think it's worth investigation. You can also make the argument that we've been moving more towards a 30-hour work week model since the downturn, and more towards a part-time economy in that sense. So I think this is worth investigation. There's a lot of direct correlations between better health and shorter work weeks, and a direct correlation between increased productivity and shorter work weeks.
Well, my better health would be not working at all, but that's a whole other matter. Bill, what about a 30-hour work week?
A mandate from the government for 30 hours? No 30-hour mandate, no 40-hour mandate, no mandate for time and a half. Listen, a century ago, it was probably the case that the cruel employers made people work 60 hours a week, and they had to step in with the government to stop it all. You know what the problem is now? It's not 60-hour weeks. It's not working too much. It's working too little. The problem is people can't get jobs, and they can't get them because the government's regulated the workplace to death.
So, Sabrina, get rid of all the work laws, all of them.
Well, I could probably go for that, and I think Bill's right that the government should stay out of this. But I think as a theory, it's something interesting. I think people are more productive when they have less time, right? I certainly know that as a mom. And I think I might disagree with EMAC on this one. I think that this could be beneficial to people who are trying to break into the job market or who are trying to stay in the job market. I sat on the train from New York to D.C. with an investment banker recently who said he's trying to keep more women workplace. Well, guess what their #1 problem is? Too long of hours. So I think this could be a good thing for women and for young workers.
Well, you disagree with EMAC at your own risk, Sabrina. I'm just warning you about that. Rick, are you going to agree or disagree?
No, I actually mostly agree with some of the things EMAC said today. Listen, I see the lifestyle.
Just because she's here and she can hit you if you disagree.
We do it all the time. I get the lifestyle benefits. I really do, and I can see how it would be a good thing in people's lives. My concern is I do think, as Liz suggested, it would come with less money. We are a consumer-based economy. This is something that could be damaging. It would have to happen over a very long term.
All right. Yeah, I don't think it's going to happen tomorrow, folks. Coming up, new